What is MIS? Multisystem inflammatory syndrome is a rare but severe complication of COVID. Although the syndrome affects children more often, it can also affect adults. The exact cause of the syndrome is unknown, but it appears to be related to the excessive immune responses from COVID. Multisystem inflammatory syndrome can be classified into two groups based on age. MISC, or Multisystem Inflammatory Syndrome in children, is typically for people who are younger than 21 years old. MISA, or Multisystem Inflammatory Syndrome in adults, is typically for people who are older than 21 years old. So let's compare MISC in the US and in Taiwan. In the US, there are 8,525 cases and 69 deaths recorded from May 2021 up until May 2022. In Taiwan, there are currently 10 cases up until June 15, 2022. These 10 cases only include children under 12 years old. The symptoms of MISC are similar in the US and in Taiwan. In both places, patients with MISC may experience an ongoing fever, stomach pain, bloodshot eyes, diarrhea, dizziness, skin rash, vomiting, trouble breathing, chest pain, and inability to stay awake, have a pale skin color, and inflammation of various organs. Most patients with MISC will need it to be treated in a hospital. So what are some treatments for MISC? Let's start with the treatment of MISC in the US. In the US, doctors may use fluid resuscitation to replenish body fluid loss, inotropic support to stabilize circulation and oxygen supply, respiratory support to help patients breathe, extracorporeal membranous oxygenation to support the heart and lungs. Doctors may also give patients IVIG and steroids to treat immune disorders and inflammation. In Taiwan, doctors didn't specify treatments like the US did. It is only reported that doctors often give patients IVIG to treat patients with antibodies deficiency and other medications necessary to treat specific symptoms. What about MISA? Currently, there are only one case of MISA in Taiwan reported on June 16, 2022. There is no data for the number of MISA cases in the US. But the symptoms of MISA are similar to MISC. In both the US and in Taiwan, different parts of the patient's bodies may become inflamed, and the symptoms may include an ongoing fever, stomach pain, bloodshot eyes, diarrhea, dizziness, skin rash, vomiting, trouble breathing, chest pain, inability to stay awake, and a pale skin color. But since it's for adults, the symptoms may be more severe due to the differences in the immune system and the potential of adults having more underlying medical conditions. In the US, medicines such as anticoagulants, corticosteroids, IVIG, and immune modulators are used to lessen inflammatory responses and reduce blood clots. However, in Taiwan, since there was only one case so far, there are no reports on what treatments doctors provide to patients with MISA. To conclude, in both the US and in Taiwan, both children and adults can be infected with MIS. Therefore, adults should look out for their children and report to the doctor if their children develop symptoms of MISC. Adults themselves should also be aware of their own health and report to the doctor if they are developing any symptoms of MISA. And in order to protect ourselves from infecting MISC or MISA, adults and children should get vaccinated as vaccines are becoming available to younger children as well.